Good morning, everyone. Okay, so I think I'm hopefully live here. All right, my name is Jessica Davis, and I am faculty with Institute of Clinical Excellence. Welcome to the PT on Ice Daily Show. And today, so I'm faculty for the Performing Arts Division, and today I'm going to talk about the low back pain in a young athlete. So this is something that's different than dealing with back pain in an adult. And so it's important that we understand some of the differences and how to deal with when we deal with an athlete with low back pain. So this is especially important when we consider direct access and when we're the first line of defense for our young athlete who comes in with low back pain. So there was a nice article, and again, I can post these two articles that I'm going to reference. There was one that's called Low Back Pain in the Young Athlete, published in 2009 in Sports Health. So it talks about that in typical young athlete, traditionally 10 to 15% of these young athletes will develop low back pain. Now you're going to see that this is going to increase in different sports. So when we're looking at artistic gymnasts and rhythmic gymnasts, the percentage increases. Up to 86% of young gymnasts can experience low back pain. So the question is, we got to think about differential diagnosis, and when this patient presents to us, we need to make sure we're addressing it properly, of course. So the pattern of low back pain in the young athlete is going to vary dramatically differently than in the older adult. So there's a couple variables that we have to consider. So on the differential diagnosis list, what you have to understand is that most often in the young athlete, the back pain is actually due to a structural injury compared to a muscular strain. So I've seen, and I'm sure all of you out there have seen, prescriptions come across. You see a patient that's been diagnosed, young athlete, with a back strain. So anytime you see this young athlete with that diagnosis who may not have had a full workup, you need to, in my mind, and this is something that it's true in the literature too, to consider, I always rule it as a fracture until proven otherwise, or something structurally wrong until proven otherwise. And so I'm going to be very cautious when I'm dealing with this young athlete initially until I feel confident that I have a good indication that it's muscular in nature. So what they talk about is when it comes to the young athlete with back pain, a muscular injury is actually something that we consider as a diagnosis of exclusion. And we need to consider all the other variables. So things to consider that could be, number one on the list is a pars interarticularis injury. 47% of the young athlete with low back pain will have this. Disc injuries are very uncommon in this population. So they're about 11% of the population compared to the adult, which is 48%. And again, idiopathic or muscular or something of that nature for the young back strain is very uncommon and lower on your differential diagnosis. So you got to consider infection, tumor, and some type of underlying inflammatory disorder. So these are things that we have to consider. So when you're doing the evaluation, you've got to look at, of course, our subjective history. We talk, of course, over and over and over in ICE about how important it is to do a good subjective history. For the young athlete, we need to know when this happened. Was it traumatic? So traumatic injuries, typically for the young athlete, you're going to see this is happening in rugby, football, some type of contact type sport. Or is it repetitive overuse? You're going to see that with your dancers. You're going to see that with your gymnasts, figure skaters. So repetitive microtrauma can lead to this. Risk factors for this population, number one is periods of rapid growth. So we know when the young athlete is growing that they don't have the adequate muscular strength and flexibility to compensate for the new bone growth. So in those periods of rapid growth, they're at risk. And at this time, usually is when the young athlete is getting more specialized in their sport. So they're going to be upping the training volume and intensity and performing, let's say for gymnastics or dance, they're going to be doing some new type of technique and repeating it over and over because it's something new that they want to perfect. These are the type of durations of time where it should be red flags that will go up that we need to watch and be careful with this athlete. Make sure that we're addressing some of the underlying impairments that can put this dancer or gymnast or young athlete at risk. So some of the things that also to consider is, the fact that, the growth cartilage and the secondary to the ossification centers are vulnerable to injury. So if there's some type of trauma or repetitive overuse, these are the areas that structurally are the most vulnerable. So that's why we need to consider a non-musculoskeletal cause of low back pain higher on our differential diagnosis list. Poor technique. So when these athletes are doing their sport because they've just grown, chances are that they may be not doing the proper technique, plus they're being pressured to perform, and repeat. So that fatigue will then lend themselves to subsequently potentially doing altered technique patterns, which if not caught early, number one, they're going to learn poor motor control and they're going to get into some bad habits, but also this can lend themselves to that repetitive micro trauma and undue stress to the lumbar spine. So when you're doing a thorough history for this patient, you want to be thorough. You want to know, are there any neurosigns? That's huge, obviously, with any patient. So if you're seeing hard neurosigns, it requires addressing immediately. You want to know the volume of training. You want to have a good sense of how many hours they're doing their sport, what's been going on. Are they in a summer intensive camp? Have they been doing something that's, are they in a tournament season? Are they doing excessive hours outside of that and they're home? You need to have a good sense of how many hours that they've been doing that's led up to this injury, especially when it's insidious in nature, right? So red flags, this is important to always cover red flags, things that will indicate, okay, I need to make sure I'm extra careful with this athlete. Malaise. So I don't know about you, but when I see a young teenager, they're often tired, but there's a difference between being tired and malaise. So understanding that, is this athlete just a little bit more fatigued than they typically are? Red flag. Weight loss, of course, any kind of neural signs, night pain. Night pain's a big one. We know that it could be in this young population, they can have tumors, but it also can be indicative of inflammatory nature. So is there some underlying arthritis that we need to be aware of? So we need to rule out infection, tumor, arthritis. So if any of those things are coming up and this patient hasn't seen a physician before they've seen us, those are an indication for a referral, okay? So, when working with the adult, sometimes we can treat them conservatively for a little while and then see how they do. But with a young athlete, a growing athlete, these are things that you just can't miss. And you certainly don't want to take a young spine that has a tumor and then put it through some repetitive trauma, right? Or stress or strengthening and not be aware that that's there. So remember to get those red flags always. So here's a good rule of thumb that this article talks about, which I really like, and it's a kind of a good rule to follow, as well as when you're educating, if you go in and young athlete. So if they've had, sometimes they don't know this, but if they've had back pain longer than 3 weeks, so that's a good rule of thumb. So if the back pain's been present for longer than 3 weeks, I know when I work with my dancers and gymnasts, a lot of them do have pain longer than this period of time. They don't think to ask about it because they feel like it's part of the nature of their sport. So that's important to educate. If it's been around longer than 3 weeks and it's limiting them and they're not able to achieve what they're able to achieve or they're pushing through it, it requires an investigation. They need to have proper imaging. What's been required or suggested is plain radiographs, AP and lateral. That's going to be a quick viewpoint of if there's anything insidious, anything that we need to be aware of. Now, when it comes to any kind of underlying spondy or fracture, often if it's an acute situation, we're not going to see it on imaging. Some will request the oblique radiograph. The problem with the oblique radiograph that they're talking about is it does cause a lot of radiation to the young child. And so some will argue, why do it? Because you should probably just assume that they have it at that point and then trial conservative treatment before exposing them to that radiation and see how they do with conservative treatment. If they don't improve, so the young adolescent athlete with back pain does not improve with conservative treatment, as we talk about in any patient that we work with, failure to improve, or if they've plateaued and we're not progressing, we're not able to get to those levels of athleticism that we expect with that age group, then that is also a red flag. That's something that we should get our feelers up that something's going wrong. If we feel as a clinician that we've done everything that we know in our toolbox to get our athlete to that next level and they're not getting there and they're still limited by some low back pain, that is a red flag. That's not normal for this population. It warrants investigation. So that requires you send them back, and they may have to have further imaging, whether that's a bone scan, CT scan. So those are the ones that are recommended. So basically, to review, if a young athlete presents to you with low back pain, number one in your differential diagnosis list needs to be some type of structural issue compared to a muscular strain. Muscular strains are of a diagnosis of exclusion in this population. So remember that. Treat it as that until proven otherwise. Trial conservative treatment, see if you make a difference. So that's just a good review. I wanted to take a little bit of time this morning to go over specific to the gymnast. So one of the requirements for gymnastics is the ability to extend. And we see a lot of these gymnasts who have low back pain. And the question is there low back pain at this point? Is there a structural injury? Let's say it's been ruled out that it's a structural injury, but is there some type of mechanical fault that we can pay attention to as a clinician and help them? So a lot of younger gymnasts, and this is the key, if you can get them when they're younger before they've developed improper habits, a lot of them will perform the basic back bend extension exercise as a way to stretch. And of course they do that when they're performing. And what is important to understand, there was a really nice article, this was published in 2016, and I'll put this up for you guys, in Sports Medicine. So it talked about stretching the spine of the gymnast. And so in this population, they have to be bendy and flexible. Now, if they're too bendy and flexible, that's an issue. And we know that hypermobility exists in this patient population. It exists for dancers. It's challenging to work with, but when they're too bendy, it's an issue because they lack motor control. And if that's our patient in front of us, that's what we have to work out, and that's what we have to emphasize in treatment. But some degree of stiffness in certain regions is imperative and will actually help them achieve their performance in this patient population. When they do their back bend, what I love about this article is it talks about where the movement should begin. And where it should begin is actually in the shoulder. They have to have adequate shoulder flexion, and it should actually hyperflex. So it should they should have the ability to go beyond a neutral position, well past that. If the gymnast does not have adequate shoulder flexibility, then they're going to get it elsewhere. And often when you see it, it's going to go into the spine. So I got this lovely model from when I was giving a talk at a gymnastics facility recently from one of the coaches. And I'm going to forever use this when I explain, but I love this. So this is a gymnast. And what's nice is if you see, so let's say this athlete doesn't have adequate shoulder, if they can't fully extend in the shoulder, right? So if they're ever so slightly here, and then you apply force, look what happens to the spine, okay? This is just an example. But if they're perfectly aligned, if they have perfect extension, and then I press, I don't go anywhere. So structurally, I'm sound. So the beginning of the movement comes from shoulder hyperflexion, okay? From then, the second aspect is they have to have adequate thoracic extension. If they don't, if you look at the literature, one of the precursors for back pain in a young athlete in general is thoracic kyphosis. So if they don't have adequate thoracic extension, then again, you're going to see that they're going to have undue stress and strain. And this, again, as PTs, this isn't exactly what's happening, but it's a nice visual when you're giving a talk to young athletes. So you're going to see they're going to get stress somewhere else in the structure, in the spine. So the movement begins in the shoulder, followed by thoracic extension. So when you're working with this population, make sure that you have that adequate mobility. If they don't, you are all creative and you can come up with the right kind of exercises to work on this. So assess their back bend, assess is there hyperextension at one segment? If you see that they're continuously fulcruming, we know that in back pain, for example, that usually it's in a segment that's repetitively stressed, right? So especially in this population. So if we know that that's putting a lot of shear force on that segment. And over time, that young athlete is going to develop issues potentially. So if we can target it early, that's where we can apply proper intervention. So obviously you're going to do your PAs and you're going to work on not only improving segmentally the mobility with manual techniques of the lumbar spine, the regions that do not move, and up into the thoracic spine. Remember motor control, right? So we talk about in the total spine thrust class with Justin Dunaway about in this patient population, even if they're hypermobile, doing a high velocity thrust can improve the motor control, right, of that region. So you should be manipulating potentially. If we've ruled out any type of actual structural issue, which make sure I'm referencing that this has been ruled out at this point, then absolutely you can work on your high velocity thrust to get that motor control, right, at that region. And then you work on exercises that are specific to developing those strategies. And that's where the creativity comes in. Also consider the hips. We talk about the hips so much. So getting that appropriate hip flexibility and strength and power, right? So they have to have proper hip extension, but they also have to have power happening in those glutes. So when you're treating them, you want to work on manual resistance to the gluteal muscles, right? While you're combining it with hip extension, minimizing lumbar extension. So get creative work on PNF, getting everything that you can do working with this young athlete. So I wanted to just kind of talk about how gymnasts we know are vulnerable to low back pain. And when this happens to them, it's important. They're scared to see you. We talk about this even in my dance medicine course, but they're concerned that you're going to tell them that they can't participate in athletics, right? And that they can't compete. So a lot of them will wait to see you, but if you can get out there and get in the communities and educate this essential aspect of it, that as a clinician, we can identify these variables that are going to put this young athlete at risk. You can make a huge difference with this population and prolong their sport. So to review too, don't forget that the young athlete who presents with low back pain, consider some type of structural issue as primary until proven otherwise. So even if you had imaging and it's still there, I would argue be conservative at first, work on other variables that you can work on with this athlete and make sure that you can get them properly rehabbed, right? Okay, so I hope I answered those questions and hopefully I gave you some enlightenment in working with this population. It's a very fun population to work with. And I'll post those articles so you have them for reference. And thank you for spending the time with me this morning listening. And I hope you guys have a great day. All right, take care. Bye.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.